As we enter the department, sterilization is the first clinical step. Sterilization is a procedure where it kills the microorganism and spores. In our college, first we keep it for sterilization here. Then we have a record book which we maintain for not to create a confusion. Here we'll enter it. We only read with the date, name, the instruments we have given with our signature.
To the sister for sterilization, which are kept in the autoclave. Right over there. Now the instruments are taken inside. The instruments are kept inside the autoclave bin with the sticker placed on the instrument pouch. Here the color of these it is a color indicator. Here the color is blue in color. When it is sterilized, the color changes to black, and the dates are written on the sticker for Now the autoclave bin is kept inside the autoclave machine. Autoclave bin is kept inside the autoclave machine. Now the autoclave machine is closed. Now the autoclave machine is switched on. Now the temperature for the autoclave is about 121 degrees Celsius for 30 minutes. The machine is stopped. Open now. Autoclave bin is taken out from the autoclave machine using a new pair of gloves is being worn so that the sterile instruments are kept sterile and to avoid any contamination. Now, after sterilization, the color of the color indicator sticker or the autoclave sticker is changed from blue to black. Now the instruments are carried in the tray and given to the operator.
Instruments have been sterilized and autoclaved. We are going to set up a tray to take the primary impression. A green cloth is placed, and then the sterilized instruments are taken out from the kidney plate and they are arranged accordingly. Betadine solution, it is given to the patient before clinical examination to rinse them out. We have some cottage, there's mouth mirror and tube, and all the trays which have been sterilized. Guys, let's see about primary impression. Impression, it is a negative replica of a teeth and associated structure. Impression is the first clinical procedure in fabrication of sealing. It helps the dentist in confirming the evaluation of the patient, which was performed during diagnosis and treatment plan. It also helps in building confidence of the patient towards the dentist. Understanding of the anatomy and supporting and the limiting structures is essential for proper extension and support of the denture. A preliminary impression is made following all the necessary modifications and primary cast is poured. Impression. According to GPT-8, it is defined as a negative likeness of copy in reverse of the surface of an object and imprint of a teeth and adjacent structures of use in dentistry.
Preliminary impression. According to GPT-8, it is defined as a negative likeness made for the purpose of diagnosis, treatment planning, or fabrication of a trait, also referred to as primary impression. We'll see about the principles and objectives of impression. An impression must adhere to the following principles. First is, the tissue must be healthy before making an impression. Next, the proper space must be provided for selective impression material. Tray and impression material should be dimensionally stable. For correct positioning of a tray, a guiding mechanism should be provided. Impression should be adequately extended to include entire basal area as dedicated by limiting supporting structures. Impression must be removed without damage to the oral tissues. The tissue surface of the impression and interior surface of the denture must coincide. Next, coming to the objectives. The objectives of impression making are retention, stability, support, preservation of residual structure, aesthetics. Now let's see what are the ornamentarium or the instruments used for making a brand image. First, we are going to set up like this. We are placing a green cloth, kidney tray. In this, we are using diagnostic instruments, that is mouth mirror and probe, which is used for diagnosis and for treatment. We are using a trolley. On that, we are placing a Macintosh sheet, enamel tray. In that, we are keeping this impression trays, which is available of different sizes. In that, this is the maxillary tray and this is the mandibular tray. We are using a autoplaner for resizing of the trays. Then we have divider, which is used for selection of trays, measuring the size of the tray. We have impression compounds or impression cakes for making the impression. We have gauze. It is placed in the water. It is spreaded over the pot. Then we are placing the impression compound. This is used because the impression should not stick to the bowl. Then we have 3 bowls of water. One is of hot water, which is used for manipulation of the compound. Other 2 are cold waters. We have spirit lamp, a jet flame. We have BP blade. BP blade is used for refining the impression and removing the excess of the impression material. We have paddler for refining and removal of excess material. We have we have tea burnisher. Tea burnisher is used for marking the posterior penetrating area and posterior vibrating line. We have actually pencil for marking of ears. We have freezer for holding the cotton.
So about this impression material, it is one of the most oldest dental impression material. It can be described as a rigid, reversible impression material with such an physical change. On applying heat, it softens. It is mainly used to take impression in virtuous vision. Then we supply us with cakes, used to make a preliminary impression in the virtuous patient. It is used to make special effect, and it is also used to check the undercuts in inlay preparation. Composition of carbon wax, stearic acid, tank, coloring agent, and resins. It is very thermal conductivity, fusion temperature, and dimensional stability. The fusion temperature is the impression compound is heated in the water bath at 39 degrees Celsius. At this stage, it will still not be soft enough to make the impression. So they will, this impression material, they will have a low fusion temperature. Next is thermal conductivity. Low thermal conductivity is seen in this impression compound. Dimension stability is the safest way to prevent the distortion is to maintain this dimension stability. Next is advantages. What are these advantages of this impression pattern? The material can be reused times. Accuracy can be very flowing the surface. Disadvantages is next. So there are some disadvantages of impression content. What are those? That it record less because of high viscosity, because of poor dimensional stability, distortion can occur, and it is difficult to remove when there are many undercuts present in the impression movement. So mandibular range and mandibular strain is very great. Size number 0 to 4 and mandibular strain 0 to 4. So maxillary tray, the tray must be completely covered with pudibus and also it must be wider than the like most the paper part of the alveolar process. And there should be like from the tray to tissue like 2 to 3 cm gap. And for mandibular also like it should cover the all seat and as well as this all the buccal portion and the anterior portion of the tooth. And there could be like 4 mm gap between the tissue and the tray. And each the tray will be covering mandibular. That's what mandibular. Right? Must be maxillary stiff stand behind the patient. And for mandibular tray, we should stand in front of the patient. For the maxillary tray, first we start the patient to open the mouth. We should retract the teeth and we should place the stool straight when it's straight. And we should see everything should be covered. Start. You can see that's good. Now maybe it should cover all the tooth structure.
You fine, say.
It should cover the retromolar region. It should cover the both retromolar pad and there should be like 4 to 5 mm gap between the buccal and lingual side.
After selection of the tray, we will manipulate the impression compound. So it's a high fusing impression material, and for maxillary tray, we need 1 cake of the impression compound, and for mandibular, we need 75% of it. So first, we have to break this cake into pieces so that in the hot water, so that it will soften properly. After putting it into the hot water, we'll wait for a few minutes so that it will soften.
Keep it in water.
So we have to manipulate the material with our hands so that no lumps are there. It is uniform and the color is uniform all over. Then after manipulating,
Yes.
so after manipulating, we'll make a dough so that we can place it over the tray. After making it in a dough, we'll again dip it in the hot water. We'll take the tray which we have selected, place it in the center of the tray, and then we will spread the material all over the tray uniformly so that it covers all the areas of the tray. And before placing it in the patient's mouth, we'll again dip it in the hot water so that the material has softened up. And then we place it in the patient's mouth. For mandibular impression, we have to break the cake into 3/4 actually. And then we put it in the hot water so that the material soften up. We leave it for a few minutes so that the material soften up and we can load it into the tray. We'll soften up the material properly so that no lumps are there and it is uniform in consistency and the color is uniform all over. Then we'll make a roll like a cylinder and then Again, we'll dip it in the hot water. So we'll take the tray which we have selected and we'll place it over the tray. And make the material flow all over the tray so that it covers the tray uniformly. Then we'll again dip it in the hot water so that the material softens and we'll place it in the patient's mouth.
So after manipulation of impression compound, now we are going to take the impression on the patient. Now the impression compound should be in the form of ball, then spread it all over in the form of triangle, then adapt to the tray. Then make such indentations in the form of maxillary arch. Then put it in the hot water. Now we are going to take the impression. Hamadi sir. First we should press the posterior part. Then we should do some border movement. First we should do in outwards, downwards and inwards. Now we should tell to the patient to hold the nose with his hand. Move it ಕೊಡಿ ತಲೆ ಬಗ್ಸ್ಕೊಳ್ಳಿ ಮೂಗಿಂದಾನೆ ಟೈಟಾಗಿ ಉಸಿರಾಡಿ ಬಾಯಿ ಮುಚ್ಕೊಂಡು ಆ ಥರ ಪ್ರೆಷರ್ ಕೊಡಿ so that we can record the PPS area. ಬಿಡಿ ಆ ಕಡೆ ಈ ಕಡೆ ಮಾಡಿದ್ದ ದೌಡೆನಾ ha. Now after taking the impression, we should remove the impression in one shot from posterior. Now we have taken the impression on the maxillary arch. Now there are some defects in this impression where the tray has come above the impression and the impression has went below, and there is a tray visibility also. Now this corrections will be shown in the refining of the maxillary impression.
Now we will take the primary impression of mandible. For this, we have to adapt like material to the tray, and then we have the operator position to the in front of the patient at the side around 7 o'clock position. It should be. Then we will take the loaded tray and then we sit in mode.
ಕೊಡು ವಾಟ್ನ ಯಾರು ಹಾಕೊಳ್ಳಂಗಿಲ್ಲ ನನ್ನೇನು ಬಿಟ್ಟು
The video that is the then we retract the cheek from the one side of the hand, then place the tray inside and ask the patient to, and we have to stabilize the finger with this mandible because there may be any a chance of fracture, and then we ask the patient for lateral movement. Uncle after this and for the anterior we'll do the lip movement. After the ನಾಲ್ಗೆ ಮೇಲೆ ಎತ್ತಿ ಇಲ್ಲಿ ಬಲದಿನ ಆ ಕಡೆ ಈ ಕಡೆ ಮಾಡಿ something else on it. Now we'll take the tray from the patient mouth. This is what is mandibular secondary primary impression. So to refine the maxillary impression, primary impression, we have to soften a little bit of material, and wherever the impression is deficient, we have to add the expose. temper it, and then place it on the and then look at it. Which is it? Maybe like
Shut up.
now we'll use the number 15 grid and define the borders. Cut it. First, what now in the instrument? Taking the video. Shall I pause? You can start. Okay, remove them. You can see that the impression has been refined. The landmarks, what? You can see that the primary impression has been recorded properly and it has been refined. And all the maxillary landmarks, so all the maxillary landmarks like the rugae, the posterior parietal seal, the tuberosity, they have been recorded properly. Now we're going to start refining with the first mandibular plus primary impression. And let's first remove the excessive material around the tray area. Right. This is the refined form of our mandibular impression, where all the primary and secondary stress-bearing areas are recorded, which includes our facial area, the ridge area, the sulcus, and the flange areas are recorded. As such, now the primary impression is done. So we will start disinfecting. Just thoroughly done from all the areas along with removal non-pieces. Next, as the primary impression and its section is completed, now we will go with what primary comes.